Coming up next on Being Well, our special guest is Dr. James Early, Director of Clinical Preventative Medicine at the University of Kansas School of Medicine. Dr. Early will be talking about lifestyle-related medical issues, mainly obesity. Stay tuned to find out more about how you can make small yet permanent changes that can result in better health for years to come. Dr. Early, thanks for stopping by Being Well. You should explain first what brings you to Charleston, Illinois, because you're from Wichita, Kansas, correct?
I'm from Wichita, Kansas. That's right. University of Kansas Medical School there.
Okay.
And I came out here to visit Sarah Bush Lincoln and to really talk about their development of health-related programs, lifestyle programs, specifically weight management programs there.
Okay. Well, tell our viewers a little bit about your background.
Be happy to. I'm a physician. Started out as a family doctor, did some time with the Indian Health Service, delivering babies and taking care of some of the Native American population. Came back and did an internal medicine residency, and then was an intensive care specialist for a period of time. Did a lot of intensive care medicine work. And during that time really understood that lifestyle issues were huge. Because in the intensive care unit, having to do spinal taps and liver biopsies and all those things became very difficult if people were significantly overweight or if they've been heavy smokers and had respiratory problems. So I thought, I'm going to dedicate myself more to preventing these things.
Okay.
And 20 years ago, helped start the Department of Preventive Medicine at the University of Kansas Medical School in Wichita, and started a weight management program there. Actually was instrumental in starting a Master in Public Health program there, and have been really dedicated now to keeping my own health up as I get into my late 60s, and helping people not get sick, basically, which is, I believe, a noble calling.
Well, you've got several areas of specialty, but I know one of them is lifestyle-related medical issues.
Right.
And do you want to talk a little bit about that and what sort of drove you towards that?
Sure. I think the more I looked at it, the more I understood that things like diabetes and high blood pressure, sugar diabetes, high blood pressure, were really lifestyle illnesses, and they were totally avoidable. I mean, most of our adult diabetics would not be diabetic if they were exercising an ideal body weight. So the idea that they need medicine, no, they need a life change. And high blood pressure, tremendously affected by exercise and diet. So in understanding that, I'm really on a campaign to get rid of high blood pressure, get rid of diabetes, and most injuries, you know, broken hips, back problems. They revolve around not having good posture, not having good exercise habits, and even nutrition.
And we've had a lot of guests on Being Well, and we talk about different diseases, and it seems like ways to prevent them: healthy diet, healthy weight, no smoking. There's so many things that can be prevented when you take care of those three main things.
They are, but we are floating in a pond of difficulty. It is very hard when out there's wonderful tasting foods that are high in calories, high in sugar, salt, and fat. And so we have to find ways to make physical activity and nutrition more fun. We have to find ways to really bring joy into the right side of the health equation.
Right, because we tend to equate fun and family gatherings with food, which is nothing new. I mean, that's been a part of family gatherings for
And there's nothing wrong with that.
Right.
It's just, what food?
Right.
You know, can't we really be exciting about some new ideas around fun and physical activity and food?
Well, before we started taping, we were talking about how, you know, the family table and the food on the table changed, like back when people actually sat down and had a meal. Talk about how that has changed.
Oh, we don't eat fruits and vegetables anymore. We've cut that by 75%. And I said the old table on the farm, you know, we had corn, we had stewed tomatoes, we had green beans and new potatoes, we had peaches, we had, I mean, it was, and Grandma insisted you have a bit of everything because she worked hard on every one of those dishes.
Right.
And if you're going to have the apple pie at the end, and if you're going to eat the meat, you're going to have all those other things too. And so we got a lot of color. We got a lot of variety. We got a lot of fruit and vegetable whole grain foods.
Well, and when I think about that table, yes, she may have made that pie crust with lard, probably cooked in butter, but none of those foods came out of a box.
No, they didn't. And there were problems with those foods in terms of saturated fat. And many people 2 generations ago did have heart disease. But we know better, and many of our products have reduced that. What we also reduced, though, was the good general nutrition out of the garden. You know, the fruits, the vegetables, whatnot. And then I hear the argument all the time, well, we can't afford to eat well. That's not true. We really need to become educated about how to eat more fruits and vegetables and whatnot inexpensively. And you can do it. 10 pounds of potatoes are not expensive. How do you garnish them? How do we get a hold of mixed vegetables and whatnot? Well, we can buy them in huge quantities at places like Sam's and Aldi's. I don't know what groceries you have that are discount, but there are ways to learn to cook vibrant foods. Story.
Okay.
The other day, we had some young folks over, and we had cut up root vegetables, turnips and carrots and potatoes, and put a little olive oil on them, some thyme, some rosemary, put them in the oven and roasted them. And one of the guys from a neighbor's son said, "This stuff's good. It tastes almost like meat." And I said, "Yeah, it is good." And I said, "These are vegetables." And he said, "No, these aren't vegetables. Mom fixes vegetables, and these aren't vegetables." So we've missed the art of cooking good food well, and that's what we need to get back to.
Yeah, because we think of good food now as something that comes either in a box or through a drive-through window.
Yeah, and we've forgotten that we can actually fix great, healthy food and have fun doing it.
Well, we had talked earlier that society has changed very rapidly in the last, from I think you had said 1990 to 2000. And the incidence of obesity really increased fairly quickly.
Right, and in this country it started about 1980 for kids. It started with fast food, the 2-liter Coke instead of the 6-ounce Coke, if you're going to have that, and fast foods really made a difference. And also the computerization. Everybody's like this now, where we used to actually walk to school. And we didn't do our iPad and iPhone at the same time.
So I would imagine as obesity has increased, all those other diseases that are related to obesity have increased as well.
It's scary. It's really scary because in the early part of my career, I never saw a 10 to 20-year-old person with adult diabetes. Now we see it all the time. And it's purely because of lack of exercise and poor nutrition. And these people, if they're diabetic at 18 because of this, at 38, 40, they're going to be in kidney failure. They're going to have all kinds of problems. And the Surgeon General's office made the statement not very long ago that this current young generation may be the first generation to die earlier than their parents did. What a sad thing. Given all we know about medicine today, why should that have to happen?
Right. Well, and I think, we see because of that, because more and more people are overweight, new products on the market all the time, new diets on the market. What are your thoughts on product-related diets or I'll just say theme-related diets? Do they work?
I'm not crazy about theme-related diets because I think, when you look at sort of the Mediterranean diet, the epidemiologic, that means what countries over what period of time lived the longest and did the best. And they ate lots of fruits, lots of vegetables, lots of whole grains, some fish in the diet. The oils were generally olive oil, monosaturated oils. And we know that works for people to live a long time. So whatever gimmick may be used, and in our programs we use meal replacements, which are very nutritious, but it's only a vehicle to get people to a vibrant lifestyle, to get them eating those fruits and vegetables, to teach them how, and to teach them the joy of cooking. And there's a cookbook called that, by the way. And so if the program is not leading to really an education-based program that can take people and help them find the joy in physical activity and exercise, that's not easy. But using some motivational techniques, using excellent education, using skilled, empathic people, we can get there. Most programs are upfront, take this, do this, that protein 1 or that, and I'm not, if that's all there is, it is not going to work long term. And I challenge anybody to show me data that shows me any of these programs will work long term if you don't also include the ability to change people's lives and really get in and help them change their lives. It just doesn't work, and I can show you the data.
You need that educational component.
Yeah, right, and the empathy and the skill to be able to help people whose lives are often in chaos get enough organization and enough family cooperation and enough worksite cooperation to really make these changes.
So how would you help someone, say it's the mom that's overweight that's trying to lose weight, trying to cook for the family, for the husband, and not getting a lot of support? Because it is the whole, it's got, I would imagine it has to be the whole family involved. It can't just be this one person trying to do this all on their own.
Absolutely. Absolutely. You're absolutely correct. I think some of the things that we try to do, and good programs do in general, is we do try to motivate with weight loss up front, because if people don't have some upfront success in terms of their weight loss, it's very hard to stay motivated.
Right.
So there's sort of a phase one of most programs, and certainly ours, where people lose weight and become empowered. Then in phase two, there's a lot of discussion of grocery shopping. How do you make some of these better foods more attractive? How do we talk to our family and try to get them enlisted? Do we bring them into class occasionally? Do we do tours of grocery stores? Do we really try to help? Now, is it always going to work? No. Sometimes there's resistance that you just can't overcome. And sometimes the timing is not right for it too. But it is probably the most complex area of medicine that there is helping people modify their home and work environments to successfully manage their nutrition, exercise, and health. And it takes tremendous amounts of skill. Any super shortcut is doomed to fail.
That's what I was going to ask. What do you think is the #1 thing that causes people to fail when they try and... Actually, the losing weight is sometimes the easy part. It's the keeping it off is difficult.
I think we have not pushed the fact that this is a life change. We've made diet, and a lot of commercial programs are at fault here by having the pictures on TV that make it look like, you know, all you got to do is come to us and we're going to change your life. No. We can give weight loss, but unless their programs are really substantial and well run over time, and affordable, it isn't going to happen. And I think the problem is it's the quick fix mentality.
Oh, right.
It's the pill-based, diet-based mentality, and we have to figure that one out.
And there have been prescription medications that have come out to aid in weight loss. Some of them are no longer on the market anymore.
Most of them are. There's a couple new ones out. Nothing is massive in terms of its. We had fen-phen in the past, which was good in terms of decreasing people's appetite. And I have no doubt that over the years we will probably develop some pills, some pharmacotherapy that do help people that have driven appetites. Those people whose chemistry really drives them to eat. That'll be helpful. But the big thing is going to be the social and public health changes that occur, that have occurred with cigarettes. Yesterday, CDC said smoking rates are down to 18% now. Why? Policy, environment, laws, taxes. We have pulled out every stop to try and reduce smoking. We're only beginning to do that by rewarding good nutrition, by coming up with more policies, more vending machine policies, more dietary. I mean, when we serve meals in the hospitals and in businesses, some businesses are beginning to change the way they do that. And incredible, once they start to do that change and start to do really exciting recipes and have the grains and quinoa salads and whatnot, people begin to say, wow, I didn't know you could do this with good food. And that's when things will begin to change, and it's starting.
Well, and I even noticed, you know, one of the fast food restaurants now lists their calorie counts right on the menu. Do you think that deters people? It deters me when I see, wow, that...
I'm not interested in deterring people. What I'd like them to do is to take those calories and integrate them into their plan. You know, okay, I can save some calories here too. Most people don't understand and aren't able to really build a calorie map for themselves. So one of our jobs is to help people understand how to put meals together, how to put days together, and really have exciting, fun nutrition and exercise at the same time, keeping the calories down, because calories in the end are what causes weight
gain.
If you reduce the calories, you reduce the weight.
So do you think a lot of the problem with obesity is people are just not informed? They don't know how many calories they should be eating. They don't know that you should be having a variety of foods, or is it?
Nothing is that simple.
Right.
You know, we've spent billions of dollars marketing foods that are easy to maintain, don't have a lot of, like, you know, the old adage that the Twinkie can sit on a shelf for 100 years and it's still edible. So, you know, companies that sell foods, if they're not perishable, then they don't lose money with the perishable foods. So we've marketed things that aren't perishable. Now, you know, we really have to begin to, and the new Farm Bill, it still doesn't really promote fruits and vegetables and good nutrition. It's a political instrument. We really need to get to be sustaining by pushing the issues of good, nutritious, low-calorie, high nutrition food. And fruits and vegetables had that list, and whole grains. And we need to be promoting those everywhere.
Well, and I'm sure you see this too. It's a generational thing. If this generation doesn't eat healthy and doesn't know about this, it gets passed down to the next generation.
Absolutely,
you know, that this generation of children, as you said, are heavier, are going to have more health problems than their parents.
And they don't know how to cook. Many of them don't. We've taken home ec out of the, we don't raise gardens as much. Now, I was out in Colorado last week, and there's some real efforts. I was in Glenwood Springs. There's a community garden right by the hotel where I was staying. We did hikes every morning. I mean, it wasn't surprising to me that in general the population looked pretty good. You know, is there obesity there? Of course, it's everywhere. But it was really interesting. You could visibly see the difference in populations across the country. If you're in middle Mississippi, for example, versus middle Colorado.
Yeah.
You can see the difference.
Yeah. Colorado, I think, is one of the healthiest
states. It
is,
but even there, the obesity rates are rising. You know, it's hard to resist the national trends.
So what do you think needs to happen? Because as our discussion has gone along, it's not just one little thing. It's a big thing.
Well, I'm semi-retired, so where am I dedicating my time? I'm teaching medical students to look at the future. I teach some medical futurism. I'm teaching some motivational interviewing so they're better at having conversations with their patients. And we've just enlisted over 200 companies in Kansas through a federal grant to begin worksite wellness programs. Why? Because if we're trying to help anyone be healthier, eat better, then their worksite needs to be healthier.
Right.
Their school needs to be healthier. Their church needs to be healthier. And by getting into worksites and really helping them change their environments and policies, we can provide 8 more hours of support for people that are trying to be healthier.
So what kinds of workplace wellness things are you looking at?
Well, we're changing environments. They're writing up policies for the food they serve and their meetings, the way they run their vending machines, pathways, the ability to take 20 minutes off during the day and exercise, adding showers and whatnot, to adding breastfeeding rooms so that women can breastfeed, because kids that are breastfed tend to be less obese. So we're asking businesses to partner with their employees for better health and lower health care costs.
Right. Healthier employees, they're not sick as much.
Their workman's comp claims much less. And the thinner a person is, the lower their work comp days off are, the lower the costs of a work comp claim are. I mean, there's all kinds of reasons for business to be concerned about the health of their employees. Absenteeism, presenteeism, all those things that happen when their employees aren't healthy.
So you're working with medical students who will be doctors someday. I would imagine, tell me how it's changed. When you were first a doctor, if you had a woman come into your office and say, I'd really like to lose weight, what would you do versus what would your doctor tell you today?
Well, when I started, I was heavy. So I would be embarrassed by the question, and I would be silent about the question. Well, you know, do what you think you should do. You know, Weight Watchers, which is fine. But I didn't have any conviction about it. And so things have changed a bit because I find the new students interested in lifestyle issues. And this is really a fairly recent phenomenon. Plus, medicine is beginning to change. We're beginning to have some, through the new Affordable Care Act, we're beginning to reward outcomes to some degree.
Okay.
So if a doctor's 1,000 patients, the blood pressure's falling for the whole group to some degree, they may get a bonus.
Okay.
If they're getting their diabetics as a group healthier, they may get some reward financially. And as that becomes more, you'll see a huge change in medicine. When they're not just rewarded for how many times people come to the office, but how well they're doing with their problems, that's, you know, that's actually matching up with the real world. As it was one person from an aircraft industry told me, if we have a plane fall out of the sky, we're done. You know, if we have a surgery that goes wrong, we do another surgery and charge twice. It's a different outcome. And Medicare is beginning to say, if you readmit a patient because you didn't do something right the first time, we're not going to pay the second time. So as we begin to insist on quality more and more and outcomes more and more, I think we'll get there. I'm very hopeful. I'm very hopeful.
Is obesity on the decline?
No.
Or okay.
But it's stabilizing a little bit.
Okay.
The data came out yesterday. It was up 0.2% in the recent NHANES study, the National Nutrition Study. So we're stabilizing, but we really need to get aggressive now. That's the reason I'm so excited that Sarah Bush Lincoln is instituting a serious weight management program that will get results, but also be fun and engaged. I'm excited about that.
So it seems, you know, if someone's sitting at home and, you know, okay, I need to eat better and I need to exercise, it seems so easy, but it's hard. What are some advice that you could give to someone to get started? Because it could be very overwhelming. Maybe they also smoke and they're overweight and it's just all this all at once. How do you sort of look at that problem and go, okay, I want to take this one step at a time? Where do you, where
as an
where should they
individual,
start?
without going to a program or whatnot, which many will need, but the first thing is, what consistent positive change can I make? The key word being consistent.
Okay.
Am I going to walk 20 minutes at least 4 or 5 days a week? You know, am I going to do that? If I'm going to do that, how can I make that a consistent change? Can I enlist the people around me to make sure that that's a change that I make long term? And I'd say consistency is the key. Don't start something and stop. Don't start something you know you can't continue.
Right, yeah.
So start with a small step, see if it works. If it doesn't, if you just can't get it done, get help. And tell your doctor about it. If you decide to make a change, tell your friends and your doctor what you're wanting to do and ask for their help and advice.
And don't take on too many lifestyle changes all at once. It's really difficult.
No. And if you are going to do a serious program, do a good program. In smoking cessation, in weight management, don't go for the quick fix. Go for legitimacy.
That's kind of how we got into this mess in the first place.
It is how we got into this mess in the first place.
Well, Dr. Early, thank you so much for stopping by. I know you've had a busy couple of days here in Coles County.
A fun and busy couple of days.
And you're headed back to Kansas. What's next for you?
Basically some worksite wellness workshops for businesses in Kansas right now. The next month is filled with those. And those are fun too. And I'm seeing these businesses, their eyes wide open. We could do this and we could do that, and we can help our employees be well. And every time I hear that, I get excited.
All right. Well, thank you so much. It was a pleasure to meet you and have you on Being Well.
Thank you. It was nice talking with you.
Sometimes doctors have to be detectives to stop the villain that's making their patients' lives miserable. And sometimes, when the condition is rarely seen and the body's own defenses are to blame, it takes a specialist. Here's Dennis Dowda with a report about a mysterious illness called Still's disease.
I played volleyball, soccer, golf.
Bethany Pouches loved sports all her life, but she feared her athletic days were over when she was incapacitated by a mystery illness.
As it progressed, I couldn't get out of bed. I wouldn't be able to lift up my arms.
For a year, Bethany battled severe and painful symptoms that made doctors suspect everything from strep infection to mononucleosis, blood diseases, and rheumatoid arthritis.
Hi! Hey! How are you?
Good to see you.
Not until she saw Mayo Clinic rheumatologist Timothy Bongartz did she get an answer. She has a rare condition called Still's disease.
Drains you, it feels like having a very bad flu. But in addition, she had a very violent immune reaction to her joints, resulting in very rapid destruction, especially of her hips.
Dr. Bongartz explained to Bethany that her immune system had started attacking her joints. The cause is not known. Still's patients tend to have high fevers, arthritis, and a rash. Symptoms may also include throat pain, swollen lymph nodes, high white blood cell counts, or high levels of ferritin. That's a protein that binds to iron. Because there's no simple test for it, diagnosis involves a process of elimination, ruling out diseases it mimics, like other forms of arthritis.
In Still's disease, you often see very prominent involvement of the wrist with a severe narrowing of the joint space, and the knuckle joints are barely affected.
Bethany needed joint replacement surgery in both of her hips to get back on her feet, but only after Dr. Bongartz first brought her condition under control. Regular IV infusions of a biologic drug that tames her overactive immune system may be a lifelong necessity.
I'm not really sure, but even if I just have to do the infusion once a month, I'm able to live a healthy life, so that's fine. It's a small price to pay. I'm healthy again. I'm able to do all the things I was able to do before I got sick, and I have my life back.
For the Mayo Clinic News Network, I'm Dennis Doda.
Thanks for watching this episode of Being Well. Join us online anytime at youtube.com/WEIUTV. Here you can view current as well as past episodes. Just look for the Being Well playlist and select the program you'd like to watch. We'll see you next time.